So I'm Myra. I started Indivisible Boca Raton back in March. And we have had an incredible 6 months, and I'm amazed when I look back and see how much we have grown and how much we have accomplished because of all of you. I think by now most of you know what Indivisible is, but I will explain it once again. Indivisible is a nonpartisan organization that welcomes Democrats, Republicans, Independents, and NPAs who are motivated to join the resistance. Our mission is to elect leaders who will reflect our values, rebuild our democracy, and to defeat the Trump agenda. September was a very busy month for our chapter. The David Jolly event was attended by over 200 people, which was a miracle considering the terrible storm that was occurring that evening. But you can join Team Jolly by contacting David Jolly's campaign manager, Chris. His email is chris@davidjollyflorida.com, but it's on the flyer that we put on your chairs. And our October newsletter will also include this important information. Our postcard writing event was a great success. About 1,000 postcards were written for the governor's race in both New Jersey and Virginia. Pretty good. Your postcards must be mailed today. So, if any of you have forgotten to do so, please take them to the post office first thing tomorrow morning. There was a very good article in the New York Times last week called "Where Trump is Vulnerable and How to Act on It" by Henry Farrell. Even the most brutal tyrant does not have enough soldiers and police officers to compel everyone to obey at gunpoint. Authoritarian regimes need civil society to acquiesce to their rule, and clearly we won't do it. We can be extraordinarily powerful when we push back. Public outrage made Disney change its mind and bring Jimmy Kimmel back to ABC. Other businesses that are exposed to the public may be less likely to concede to noxious administrative demands. With all this in mind, we are going to lend our support to Blackout the System, a national movement organizing collective boycotts to confront economic exploitation, injustice, and corporate abuse of power. Their next nationwide blackout is happening November 25th through December 2nd, and yes, I know it is Black Friday, but you're gonna have to do your best. And everyone can take part. Learn more on how to get involved. The link is on the flyer. We are also initiating a Fight Publix open carry policy. Publix is the only local supermarket chain that is allowing this policy. Sign our petition today, it's in the front. And we also have an online petition that you can share with your friends and family. Start boycotting Publix. If enough of us do this, their bottom line will be impacted and changes will follow. Marching in the streets and peaceful protesting is another way to push back. The Saturday, October 18th, is our next National Day of Action, No Kings 2.0. Come to our in-person rally at Boca Raton City Hall, or alternatively, South Palm Beach County Indivisible has organized a car caravan that will be circling around and supporting our rally for those of you who would rather be in your car. It is anticipated that this protest will be the largest protest ever to be held in the United States. Remember Woodstock and how sorry you are that you weren't there? This is your chance to be a part of an event that will have historical significance. Do you know that when I left the house, I already had 1,000 people signed up? Pretty good, right? Bring your signs, bring your friends, and meet us at the Boca Raton City Hall from 10 to 12 on Saturday. T-shirts, there are not very many left, but they're still available. Get yours for the Saturday's rally. Now, we found a perfect location for our Rush Hour Visibility Brigade. This will be at the overpass on Clint Moore Rd, just east of Congress. There are actually parking spots before and after the overpass, which makes it a perfect spot. We will be setting a date in November for our first brigade protest. On Monday, November 3rd meeting will be all about immigration. We have 3 extraordinary panelists who will help us understand the current situation and what we can do to help. In lieu of a December meeting, we will be holding a holiday party. Yay! And it's going to be on Monday, December 8th. Keep that date open and details will come in November. When I attempted to get speakers for tonight's panel, I kept getting the same response. With the political climate as it is, people were terrified to commit. We saw this firsthand when Dr. Karen Leder, a tenured art history professor, was put on administrative leave because she shared content critical of Charlie Kirk's opinion. You can sign a letter to support Dr. Leder and other university professors who are still not able to return to teach students due to this crackdown on free expression. Information is also on the flyer. We all have to remember the words of Timothy Snyder in his acclaimed book on tyranny. His first chapter tells us not to obey in advance. His last chapter urges us to be as courageous as we can. If we obey in advance, all will be lost. And in the words of Franklin D. Roosevelt, courage is not the absence of fear, but rather the assessment that something else is more important than fear. What we are doing is vitally important. What we are doing matters, and what we are doing will ultimately make a difference. Tonight, we will be discussing RFK Jr.'s assault on health policies in the United States. He has attacked science. He has demolished regulatory agencies. He has made cuts to vaccine manufacturers. He has spread untrue conspiracy theaters about autism, vaccines, disease treatments, Tylenol, the Food and Drug Administration, prescription drugs, the American Medical Association, and other rigorously tested medical practices. Not holding any sort of medical degree himself, but proclaiming himself as the highest authority, RFK Jr. has quickly dismantled a health infrastructure that will take decades to get back on track. We have 2 panelists tonight that were willing to speak out, and I am grateful to them both. Let me introduce them to you now. Dr. Vasiliki Papadimitriou is a practicing pediatrician in Boca Raton. She trained at the University of Florida College of Medicine and is certified in pediatrics from the American Board of Pediatrics in 2015. Her practice, Pediatric Associates, has been in existence in Boca for over 60 years. My own grandchildren love Dr. Papadimitriou, and in my mind, that is the highest recommendation you can get. Please welcome Dr. Papadimitriou. Our second panelist is Jane, who holds a master's in social work. Jane worked as a social worker for schools, family agencies, children's clinics, and private practice in a career spanning 49 years. Since retirement, she has done extensive research and has given talks to groups about anti-Semitism's corrosive effect on nations. She hopes that she can add to this presentation in a way that helps all of you find your way through these very difficult times. Please welcome Jane. And our panel will be led by our very own Bonnie Miller. Yay, Bonnie Miller, come on down.
Robert F. Kennedy Jr. has repeated the claim that vaccine causes autism, a theory long disproven by every major health agency. When parents bring up that concern, how do you explain what the research actually shows and help them feel confident about vaccinating their children?
Well, first of all, I just want to say good evening, everyone. It's such a pleasure to be here. I'm always at work. I'm basically an educator. I'm not just a physician, so I'm so happy to be here to help educate you and help keep you properly informed. Going back to this question, I get asked a lot about the misinformation that's going around, particularly what RFK Jr. has said, and unfortunately, all I have to do is simply state, he's not a scientist, he's not a physician, he's not a researcher, but he certainly is an attorney. He's a career attorney, so he doesn't know the science, unfortunately, guys. So, you know, honestly, between the scientists, researchers, physicians, we have all involved ourselves in many years of schooling, a lot of education, a lot of time dedicated to our expertise. So it's important that all we can do is reassure parents that this is what I do for a living. I am not an attorney. And contrary to what he does say, unfortunately, he does quote articles that do exist that are published and not, how do I say it? They're not journals that are notable. They're not journals that a physician would use as reference to say, hey, was this a good study? Was this a bad study? He goes to, journal articles that have been debunked, that don't have the proper information, and he leaves out all the meta-analysis, all these other articles and research that have been published and repeated time and time again with the same results. That's how you get proper, accurate information, and this is what I tell parents. I take the time, non-judgmental. All I can do is not have them feel like they're being pushed away. I want them to feel like they have the proper information, and that's what we do every day, day in and day out.
Jane.
Yes.
RFK has claimed that the common antidepressants like Prozac or Zoloft are connected to school shootings. Experts say there's no evidence for that and worry such claims make people afraid to seek treatment. From your perspective, as someone who worked in the field, how may statements like this affect public trust in mental health care?
First, Bonnie, before I want to directly answer your question, I want to say something about RFK Jr. We have to keep in mind that this man was a young boy when his father and his uncle were assassinated. And there were conspiracies galore, right? There still are. So he was really raised in that. So it's not a surprise that that has really become his way of seeing the world. Now, I as a social worker could say, oh, I'll empathize with him as a human being, but he is not qualified to be in the position that he is in. First of all, as a pediatrician has already said, he's not a doctor. He's not an MD. He's not a DO. He's not a scientist at the bachelor's level, the master's level, or the PhD level, for that matter. So how is he able to discern if something he hears is scientifically true or a made-up conspiracy? He really cannot distinguish that. Okay, with that said, of course, and I want the audience to feel in their questions they can react to what I'm saying. Him saying things like this must scare so many people. Scare them, make them angry, make them confused, make them feel a little helpless. And that's why we're here, to talk with you, and why your professionals, your physicians, are there to be spoken to also. For example, this question that Bonnie just asked. Could one of these shooters, these mass shooters, could they be on one of these medications, one of these antidepressants? Sure, but that doesn't mean it's cause and effect. That doesn't mean their being on these medications are actually causing them to be a mass shooter. I personally and professionally, my work and my personal life, I'm conservative about medication in general. However, especially with children, you have to weigh the pros and cons of a child being on medication. And many times they really need to be able to function well. This is an important discussion between a parent and their doctor, between a parent and a professional. And if a doctor has put someone on a medication, they're not just left out on their own with it, it's followed up. So the main thing is to find a trusted, well-trained therapist and or psychiatrist and a pediatrician, and trust in their suggestions. If you're not comfortable with what you're hearing from a particular professional, feel free to seek a second professional opinion, right? And I always feel that's fine. People need to feel comfortable with what they're hearing. So ask your physician even for the name of a psychotherapist, because they really know who are really competent people.
Great, thank you.
All my answers won't be that long, don't worry.
That was a good answer, though.
Good answer. He has also said that the standard childhood vaccine schedule is unsafe and that too many shots too soon can overwhelm a child's immune system. How do you address that idea with parents and explain why the schedule is structured the way it is?
You know, it's not just RFK Jr. saying it now. I mean, he said that for years, but I've dealt with this as long as I've practiced, and before I've come into practice myself, the people that have come before me doing pediatrics have dealt with parents being afraid of the schedule. The schedule, friends, is there for a reason. It's been analyzed and studied. What is the best way we can get our kids protected, our babies who don't have any immunity to anything, and they are the most vulnerable population, aside from people who are immune compromised or elderly. Babies don't have any kind of protection. So for us to risk changing the schedule that we've known for years to be just so reliable and it's like our fallback. This is what we rely on. To change it is so risky. I can name a number of vaccines that are so important that people always question, why are they given in infancy? But they're very important. I could go through each one of them, but that would take me all night. There's a reason for all of them. And if ever a parent comes to me asking specifically, let's say about hepatitis B, why are we giving babies hepatitis B vaccine? That's a sexually transmitted disease. That's for people who are drug users, needle users. And I'm like, no, it's not how that works. It's actually, it's transmitted by other ways, and those babies are so at risk. So once I go through explaining all of that, they're like, oh, so they get it. There's some people that, are like, they really put their foot down and like, nope, I don't want it, because they came in with that decision and they're gonna leave with that decision, and that's it. They don't want anybody to convince them otherwise, even though they know science.
Vicky, during the pandemic, Kennedy called the COVID vaccine the deadliest vaccine ever made. Meanwhile, Trump got a COVID shot last week. Have you seen lasting hesitation around vaccines because of that kind of statement? And how do you rebuild trust when families bring those fears to you?
I will say, in my own practice, I can only speak to what I see every day at work. I haven't seen that huge of a difference in hesitancy. It has increased somewhat. Definitely have a slew of parents that, like, are you giving the COVID vaccine? Does the flu vaccine have the COVID vaccine in it? We're not getting it. I'm like, no, we actually don't carry COVID vaccines in our office anymore because there's such a low demand for it that we had to keep them to specific offices so they wouldn't expire. So that goes to show you, yeah, there's not a huge demand. There is definitely some hesitancy. A lot of people will argue that the COVID vaccine, because it went out so quickly, Operation Warp Speed was Trump's claim to fame, right? It created such distrust because it came out so quickly. And I said, you know what, this was, what I always tell parents, this was probably the quickest a vaccine was studied, but in such a huge population of people prior to it even being expanded to the public before I got my vaccine, because people were willing to give it a go, give it a try and see if it would work. And they were willing to sign up for these studies. Lo and behold, it was actually probably our saving grace during a pandemic. It saved a lot of people from long COVID, from death. And to be honest with you, no vaccines without zero risk. No medicine is without zero risk. So I have to say just that. There's this small chance that, hey, listen, somebody's gonna have a side effect. And I have heard some stories. There's stories, I haven't heard of anybody firsthand telling me that the COVID vaccine messed them up. So I can just tell you that much. And prior to that, the FDA never once said, hey, we need to stop giving COVID vaccines. This is just one person say so. So that's all I can say to that. There's a science behind it, and him calling it the deadliest vaccine is strictly his opinion. And there's no backing behind it. There's no science behind it. It's still safe to get. Still safe to get your booster. I'm so glad that people don't require their prescription to go get it. They can just, strictly get that conversation with their physician. Once again, consult with the trusted, experts and say, hey, should I still get my booster? There's very few people are gonna say no.
Jane.
Yes.
He has said antidepressants are more addictive than heroin. Drawing on your experience, how might rhetoric like this shape how families or communities view mental health treatment today?
Well, I think that people need a lot of correct information on this because there is no comparison between antidepressants and heroin. It's not like comparing apples and oranges. It's like comparing apples and chop meat. I mean, it is that
I second that.
different.
It's so silly to even compare it. It doesn't make sense, right?
Absolutely. Antidepressants, and this speaks to something you were saying, Doctor, about sometimes people taking a Tylenol overdose. Well, antidepressants are medication. And with medication, it's regulated. It says on the Tylenol bottle how much you're allowed to take. So you know what is a safe dosage. And if you go over that, it could be unsafe. So medication is regulated, it's prescribed by a medical professional, and it's supervised by a licensed medical professional, okay? There's also ongoing research done on medication, so if there's any change in knowledge about it, the doctors are going to know about that. We do not call heroin a medication. Heroin is a drug. It's not medication. Why? It's not regulated. It doesn't tell you take this amount on the syringe. It doesn't come with a prescription. And it's not supervised. Heroin clouds your judgment. Antidepressants do not. I have no idea what he's thinking. I was trying to get, as a therapist, I'm trying to get into his head. What could he possibly be thinking? Well, maybe he feels some people don't get off antidepressants because they feel good on them. They don't want to get off of it. Perhaps they had a bad experience getting off a medication, okay? But if you talk about a bad experience, if you're on a medication, you talk to your doctor, you want to get off, the doctor helps you wean off of it in a safe way and in a way you're not going to feel sick, okay? Now, some people say, oh, I'm not going on the medication. Well, they go cold turkey. Fortunately, the worst thing that happens to them, because I've had patients come and say, I feel so dizzy. I've had a headache all day. But it's for a day or so, and that's it. Nothing terrible happens to them. Now, there are some old medications like Valium that can be addictive, but that is something the professionals will know about. All you have to do is talk with them about it. Heroin is very difficult to get off of. Over time, the person needs more and more and more of it. And it's a major project to withdraw from it, and you feel pretty sick during the process. So, as I said, you just can't compare them.
Vicky. His organization has been linked to communities with low vaccine rates and later experienced outbreaks of measles and other preventable diseases. Have you seen similar consequences of vaccine hesitancy in your own practice?
There's always a certain percentage of vaccine hesitancy that we've experienced, me and my colleagues. It's always there, it's always underlying. I mean, like I said before, all we can do is provide the reassurance that they are safe. All I ever tell parents is, hey, listen, I've never had a patient had a bad reaction other than a fever from their vaccine. And I've been doing this for a while. My colleagues have been doing this for a while, and they can also attest that they've never seen anything really bad come out of a vaccine. Maybe a febrile seizure, and guess what, a febrile seizure, a one-time febrile seizure, does not mean someone has developed epilepsy or seizure disorder. It's simply due to a very high fever that just escalated out of nowhere from their vaccine. But the fever is also, it's a sign of responding and having an immune reaction and saying their vaccine, their immunity is working with it. It's becoming effective. You know it's working by having a fever. And that's all I can do is provide that type of reassurance. But unfortunately, fortunately, directly in our community, we haven't seen any crazy measles outbreaks, but we saw recently, not that long ago in West Texas, how quickly that spread. It stayed within West Texas for a little while before, people travel. This is a very come and go society. We fly all the time. We drive in and out of state all the time. It spread. It spread like wildfire. Measles is highly contagious. So now we can see in North Carolina, we're having the same outbreak. There was like, what, 50 kids? And now they're basically isolating. I don't know how many students in this community in North Carolina where there's a whole slew of kids that are not vaccinated. Eventually, with that outbreak, we're probably going to see, again, hospitalizations and maybe a few deaths. I hate to say it, but measles is nothing to play around with. So yeah, I mean, we've seen the hesitancy, but again, all we can do is provide reassurance. I am fortunate. I live in a community where people are pretty well educated, I have to say. And even if parents are pretty hesitant, they do eventually get fully vaccinated. So I'm happy for at least that, the small wins.
Vicky, misinformation about vaccines spreads quickly, especially online. What communication strategies work best for you when talking with families who are skeptical about open to learning more?
All I can do is offer up that conversation. I never shame them. I never make them feel bad about what they've read online and what resources they're following and saying, hey, that's ridiculous. Why did you read that? No, it's like such a wrong way of going about it, right? So all we can do is have that openness and conversation. And if they really don't want to have it, hey, listen, I have lots of parents that just put their foot down. Nope, I don't want to hear about it. But then I have most parents, I think, are just hesitant. They're opening to hear about it. So we do try to have that conversation. But I think that's the first step, is saying, hey, can we talk about it? Like I said, very few times they just say, no way. I don't want to put that poison in my kids. It's very rare. So again, being in a community where I don't have to battle that as much, where people are just more so hesitant than they are decided. And all I can say is use our politicians as a good example. I hate, people will say stuff like, let's not get political about this, stay in your lane. Mm-hmm. Hey, guess what? Medicine is my lane. Public health is my lane. There's no other way about it, I'm sorry. But when you start to interfere with the correct information, the bottom line is they are making this political. I am not. Right. I've always tried to make this scientific and about your baby's health, your family's health. And in the end, when I tell them, hey, listen, all of Congress is required to get fully vaccinated. Right. Their flu, their COVID vaccine. The president has recently received both his flu and COVID vaccine. He himself has said, even though sometimes he kind of backsteps this, he himself has said, I think the vaccines are important. You should get vaccinated. And guess when Florida announced that they were going to try and get rid of the mandate, which I don't know what's going on with that. I never know with Florida. I love my state, but gosh. He said, I think it was kind of I don't know, if you ask me, a tactic to kind of look, I don't know, popular in Trump's eyes. And he said, oh, I think vaccines are important. So I think as pediatricians and physicians appreciated that he did reinforce their importance, even though he says, oh, I think they should be spread out whenever RFK says something, but
good answer.
I think that sums it up, right?
Jane.
Yes.
Kennedy's movement has used social media to question mainstream science. How do you think the rise of online misinformation has changed public attitude toward mental health and social services?
This is probably the most dangerous information coming from the Health and Human Services Department, in my opinion. In societies where religion and science live side by side, civilization flourishes. In countries and civilizations where they decide to dismiss science or devalue science, but keep religion, it has really seriously affected the thriving of that civilization. So it is up to all of us to advocate for science and rigorous scientific research. It's our job to do that.
That's great. Vicky. Here's another question. On Tylenol in pregnancy and newborn circumcision as to the cause of autism, how do you reassure pregnant parents that taking Tylenol or circumcising their sons will not cause autism?
Okay, all I have to say is I hear all the giggles, and just based on that, I know how many people are finding this so silly, right? There was like 1 or 2 articles that were basically just showing, hey, this is happening and this is happening. Tylenol use, autism incidence. But guess what, guys? Tylenol use is not increased. Autism has not increased. It has not increased in incidence. I'll tell you why. A lot of people say, yeah, why is there so many autistic kids now? Why is there such an increase in numbers? Hey, guess what? You know, back in the day, we would hear about savants. Later, we would hear them referred to as having Asperger. And guess what? They're all on the autism spectrum. So it's not that we have an increased incidence of autism. We simply have an increase in the number on the DSM criteria that we increase the number. It's been collectively put on one diagnostic criteria. There's multiple levels of autism. That being said, no, Tylenol is 100% safe. There's a rare case that somebody might have an allergic reaction to it. If they overdose on it, heck yeah, they're probably gonna end up in the hospital with some kind of liver failure. That people can die from Tylenol overdoses, but it is safe. And you're taking away basically one way pregnant women can relieve pain or fever during pregnancy. I don't think it's fair to take that one thing away that's actually found to be safe. The ACOG, American College of Obstetrics and Gynecology, has spoken out against that and also said that it was safe. And guess what? Also, with regard to circumcisions, good grief. It's not going to give anybody autism. So the argument he was using is that there's increased Tylenol use with babies after getting their circumcision. Well, guess what? There's another little surprise behind that. What we use for babies prior to getting their circumcision is a type of sugar, a sugary liquid called sucrose. And I've seen it in the hospital. They dip it in that tiny little tub of sucrose. They dip their pacifier, put it in their mouth, and what this does, it's an interesting science, folks. It actually helps release endogenous opioid type of chemicals that help the body create its own analgesia, its own pain relief. So with that being said, we're not using Tylenol so much anymore. Circumcisions heal within a week, probably less than that. They're very quickly healed, especially in babies. Everything heals so quickly in them. So no, there's no basis for that. There's multiple studies that actually show its safety. So I wouldn't go out and tell everybody, oh, don't circumcise your baby who's expecting to have a baby boy anytime soon. And don't make them feel bad for taking Tylenol if they've had to during pregnancy.
With so many public voices undermining confidence in vaccines and medicine, what role do pediatricians play in helping restore faith in science and public health? What approaches have you found most effective?
I think the biggest approach is not only knowing the science, but knowing the history. how public health was pre-vaccine, pre-antibiotics, and how it is now, I don't think a lot of people, maybe some people do know the history of what an impact vaccines have made on allowing kids to live past the age of 5. Prior to the implementation of not just antibiotics, but also vaccines, I don't know what percentage it was, but it was pretty significant percentage of babies, I call them babies under the age of 5, they're still our babies, did not survive things such as polio, diphtheria. I mean, it was the last time I saw a diphtheria case or anyone's ever heard of it besides measles, right? And so many other preventable diseases. All I can say is just remember the impact that it has made. Stop thinking about the noise that you're hearing that says it's making us unhealthier. That's the weirdest statement I've ever heard RFK Jr. say, that America's been less healthy. I try to just really reiterate the impact, the positive impact that science progression has had. And say, hey, listen, our babies, half the time you would be bringing them in for really sick visits, or you'd be in the hospital. There used to be a whole measles ward. There used to be a whole polio ward. People used to live by an iron lung. It's really unfortunate. I remember one of my ICU attendings when I was in residency, he was a polio survivor and he had a limp. And I asked him why one day, and he said, because he survived polio. And even then, when it first came out, that vaccine, there was some hesitancy, but then they saw how many people and how many children were dying. People ran out to go get it. And also helping them realize that in developing countries or underdeveloped countries, people walk for miles for that polio vaccine. There are still polio outbreaks around the world. There's so many other types of outbreaks around the world. We're currently experiencing a pertussis outbreak locally. Whooping cough is no joke. A lot of these are no joke. It's anything that can present harm to our babies. And by doing that, I think it's irresponsible not knowing, at least knowing and educating yourself and knowing more about it.
Kennedy has also described medications for children as a threat. How do you think the kind of language influences how parents think about therapy and medications for their children?
So I'm kind of going to piggyback on like the antidepressant prescribing and use for kids. And I've heard these public figures say time and time again, oh, it's addictive, it's dangerous. Hey, listen, you know what? I've seen so many kids, because I treat this regularly in my clinic, so many kids struggle, and I mean struggle with their ADHD because they just cannot keep up. Their confidence is so low. And listen, I've seen these kids also present with coexisting anxiety, even some depression, because as a result of it, I don't diagnose them with all those things. I say, let's treat the root cause, that somebody likes to use that term so much. We hear RFK say the root cause all the time. I think it's so funny. I'm like, well, the root cause is actually what you're telling us not to treat. And after I see kids getting properly treated for depression, for anxiety, for ADHD separately, when they're most of the time separate situations, they're thriving. They're different kids. They're less likely to seek out an addictive drug later on in life, because these, again, going back to, these are FDA regulated medications. We follow these very closely. If they haven't been in the office in over 3 months for a recheck of their medication, we don't prescribe it. So it's very closely followed, and guess what? We don't want to get in trouble either. These are class 2, I think. They're controlled substances. That's the category that they fall under. So no, I am not I'm not a fan of them saying that it's bad that they're being treated for it. I think it's bad when they don't get treated for it and parents are so hesitant and so scared. What is this going to do to my kid? And I just tell them with my own experiences. My oldest child is on the spectrum. He has ADHD that often commonly comes with being on the spectrum, and my youngest also has ADHD. I am like the poster child parent for telling you firsthand what my experiences are. And I would never do something for your child that would be bad for mine. Just put it that way. Their babies are like my babies. And my job means the world to me, and that's why I went into it. It wasn't to harm anyone. And back to like also the second opinion, I never make parents feel bad if they want to just wait it out and seek out advice from another professional. If you get offended, I think as a physician, I think that's a bad sign.
I agree with you, totally. You know, just adding to that, I've seen children who, one person just popped into my mind as I was going off, who really would have been in terrible trouble with a group of his peers because they were smoking marijuana. Now, I'm not talking about the marijuana now, I'm talking about in the past when you never really knew what you were smoking, and you know, they had they call it the hallucinogenic kind of aspect
what it's
to
laced
it.
with and everything.
And this child would have he and his group were going to get into so much trouble. And he says, well, I smoke marijuana because it keeps me calm. So I said, well, what if I told you? Because I said to him, doesn't look like your judgment is good, right? You're not high now. What do you think about what you've been telling me? Then I said to him, what if I told you that I have something that's medication that could make you feel calm like that? What would you think? He said, oh, I take it, you have it. So, you know, a lot of times they want something, and this child needed it. Thank goodness he was on a good road after that. But, okay, so you had a question?
You've got the last question.
Last question.
Having seen social work evolve across decades, what advice would you give to younger professionals about countering misinformation while keeping empathy and trust at the center of their practice?
Well, going along with you, first, we should not judge them. We don't know where their information comes from. And you know, a lot of people get their information on the internet. And, you know, truthfully, I like getting recipes from the internet, different information. But people go on often for medical information. And I don't judge anybody for that because I've seen the smartest people do that. And you don't judge them. You can talk to them about what's the source? Where did you get it from? Okay? Do you think it was a reliable source where you got the information? And also, does it make sense with other things that you know? Does it fit or does it not jive with whatever else you know? Today, too much of education has been focused on not learning to think and analyze what you hear. And that's really a problem. So talking to younger people about that, not judging them, not making them feel badly, but helping them think about what they've heard. And also, who is a reliable person to go and check out this information?
That's awesome you said that, because I was just saying the other day, I said to a close friend of mine from college, I said, this is what we're lacking now is information being basically fed to us. Mm-hmm. Would you say that? It's kind of like fed to us, but also some, you know, listen, it can be fed to us, but we can also always promote critical thinking, like you just said.
Exactly.
We always have to remember to think for ourselves, think independently, and always question things, even if they're right. It's okay, because you can always get reassurance from your local expert, whoever it is. And in the end, you know, I just seen so many people profit from being online and feeding this information, like what these wellness influencers, they're promoting their vitamin, they're promoting their book, they're promoting their own diagnostic imaging, not mammograms for cancer, which we know is the first line for screening for cancer, other than, family history. But it's just wild. And I say, it is wild. It's the wild, wild west. We have to remember to not get tricked or fooled by all this.
And then check it out. My husband is a retired pediatrician, which I do. I cannot tell you how many people we know, smart people, have had a medical appointment and then they went to the internet to find out what this meant or that meant. And they ended up calling my husband. Oh my gosh, I went, and he says, I told you, don't go on the internet. Ask the doctor. So it is like a wild, wild west.
It is true.
You're right.
And the other thing is I try to remember, I'm like, not everybody understands like the terminology that I was trained with. I need to remember to always speak in lay terms to not just the parent, but the child. They're also involved in part of that team-making process.
Right.
That team-making decision of whether they want to start a medication, whether they should be on the antibiotic. I don't just say, hey, this is what you got to do. Remember, this is always a team effort, I always tell them. And I think with that, I gain a lot of trust from them and less going to the internet. Do they still do it? Yeah, absolutely, especially my teenagers. I love using the internet as a resource. And I think the other scary thing is knowing that we're going to have people going to use AI.
That's scary.
And it is because what they call AI hallucinations. Have you guys heard of this term before?
No, tell us.
So basically, there's this thing. I don't know what you call it, a syndrome of AI. Now they have syndromes. That they over-exaggerate or hallucinate and give you like wrong information based on just stuff that they're making up because it is artificial intelligence. Anybody can make up stuff, right? So AI does a similar thing.
Adverse drug reactions are the fourth leading cause of death in the United States. I'm not making it up, it's true. So, are you aware of pharmacogenetic testing where every one of your patients can get a genetic test before you prescribe them a drug to make sure that you don't give them one that will be ineffective or harmful?
So yeah, I'm fully aware. I've had a lot of parents present that concept to me of getting pharmacogenetic testing, and unfortunately our office doesn't do it, but they can always do it. I always let them know, like, hey, listen, you can always get this done at an outside lab, bring it to me and we'll discuss what's probably the best option. I don't rely on it completely because, fortunately, unfortunately, I did have a patient. We initially started on an antidepressant because her pharmacogenetics matched up to it. And she did really well with it for a while until she didn't. It just didn't work anymore. And so then we went to the next best thing that I probably would have started her on. And that was fine. I'm always open to creating that team decision, but I don't rely on it completely. What was it you said something about the side effects of what? Of medications or?
There's two things, effectiveness and side effects. There's a new federal law that you can't give certain chemos anymore without giving the pharmacogenetic test first. There also are many states in the United States where you cannot prescribe any mental health drug without doing a pharmacogenetic test first. It does have side effects of suicide and homicide, which is where the shooter stuff goes. So all I'm telling you is that science has been proving this since 2009. This is 2025. So please, do it.
No, of course. Listen, I'm open to things that are new, but I always want to make sure that they are evidence-based, I should say. And I don't think all new things are bad. I just think we always need to know more about them. And I think the more we learn about them, the so little that we find out we know.
If I can say something about the antidepressants and your concern about homicidal, suicidal thoughts, God forbid, behavior, when children are on, when children are on antidepressants, they should be in weekly counseling. Because then there's someone following them up. They're not just going out there on the medication, and if they don't say anything to the doctor or see the doctor soon enough, they may not. But usually, my feeling is that the therapist, these pediatricians look to a therapist
Absolutely.
to help. Not that it doesn't happen. It's not that it doesn't slip up. But it's also hard to prove if it is from the antidepressant.
It's true, the single most effective way of treating anxiety, depression, I always tell parents I follow up with, you need to be starting to see a therapist, because I can only do so much here in the office. I'm not a certified therapist. Please make sure that you start therapy, and doing cognitive behavioral therapy along with medication is more effective and safer than doing medication alone. So I am a big proponent of that, and with that we can keep surveillance of that.
I want to thank you all for sharing your expertise. Jane, you tried to explain why Kennedy is a conspiratorialist based on the death of his
I'm not
father.
analyzing him from out of the office.
I'm not talking about that.
Yeah, oh, okay.
My question is,
Yeah.
why? Why are there people like Kennedy and Trump who believe in conspiratorial theories? You all were telling us, be skeptical, look at the science, find out what's true.
Right.
And we are being led now by people who have a distorted view. So my question is, why? Why are there people like this, and what can we do about this? That's my question.
That's a great question.
It's a terrific question. You want to start?
I was just going to say, what I have observed since the beginning of all that is that they are experts at deception. Thank you. They have you looking at one thing while they're doing something else.
They're like smoking mirrors.
Oh my gosh, yeah. So like distracting you with all these health misconceptions and such. I feel like a lot of it's just to distract us.
I agree, and I think if I could put a little plug in here, I think it is really why, we're not talking about political things, but I think if we have friends who think differently, instead of doing what a lot of us do is, oh, how could they think that? To really talk this out, to try to see if people can at least be open, even if they end up not agreeing, just sort of seeing that other people come from a different place, and maybe something like that would be helpful.
I have a friend who goes on the computer and listens to doctors talk about drugs and things like that. I just want to I've been in the technical world my entire life, and what is happening is AI can be very positive. I've used it with a lot of fun, and recently someone put me onto a certain thing, and it was an AI representation of a picture of Dr. Sandra Gupta talking about a Alzheimer's drugs, all right? And this person went and ordered it. The problem was I started to do research, and all over the web, if you go to the right sites, you will find that AI has misrepresented authorities using AI and encouraging people to purchase these drugs, which are not what they say they are. And I just think that when you talk about things and people are doing it, you have to educate the public somehow. It's a terrible, terrible thing that's going on.
Yeah, it's scary because it looks realistic
It
too.
looks totally realistic.
I didn't think they could use their images without their permission.
I have trouble convincing my clients that it isn't true. I mean, that these are not the real people who we're talking. Because you can do it with photos, you can do it with voice, and now some of the banks are even saying, oh, by the way, we have a new way of validating who you are. Would you like to say a few words or give us your name, and we'll validate you on voice?
Oh,
I
my
suggest
goodness.
nobody do that. Okay, the second thing I have.
Well, stay with that for a second.
Okay, go ahead.
Because I think that we all have to realize that we can't leave everything up to other people. You realize this, you tell as many of your friends, you tell your friends to warn their friends and family. I think we have to do this and try to protect one another.
I send emails with copies of what I read.
Perfect, perfect.
The other thing I would love your comment on is that a number of people I know, as their children have grown up and looked, met men to marry, the girls marry, older men, okay, as you know that this is very fashionable and so forth. I think Donald Trump is a proof of this with his current wife, and what I'm leading to is nothing political, but I understand that there's something in an older man that his sperms are not as strong as the younger men who have babies with the young women. And I don't know if you've heard or have any scientific research on that, but I've heard that from very, very knowledgeable medical people.
I've heard that, but I can't speak to it because it's not within the realm of my expertise. But I mean, it's very similar. It's similar. Well, you know, the thing is, it's similar to a woman's eggs as you get older. I mean, when you know. If you've ever been pregnant and you've gone to an obstetrician gynecologist and they've said, okay, you're past the age of 35, you are advanced maternal age. It puts you at higher risk of having a baby who has some sort of sex chromosome or some sort of chromosomal disorder like trisomy. Trisomy 21, trisomy 13, you name it, there's so many that you become high risk of, and I'm sure that there's something to do with sperm as well. There's got to be, but I would probably consult with someone in that area.
Read a lot about it. That's what.
No, you're right. There's not that much information that's readily available as there is about, like, say, women's health.
Do you have an OBGYN doctor that you still see at all?
Do I?
Yeah.
Not at my age.
Well, if you did, unfortunately, we don't have an OBGYN doctor up here today. But that's a question to ask them, because they probably know a lot better, right?
Oh, I'm sure they have a better idea, especially those that work in IVF.
You spoke eloquently and persuasively about RFK Jr. not being a doctor or a researcher or a scientist. In Florida, we have a doctor, certified, Harvard-educated doctor as our Surgeon General.
I know who you're talking about.
Who seems to say a lot of things that run counter to the medical profession. How do peers view him, first of all? And is there anything license-wise or certification-wise or something that might be appropriate for somebody who spouts things that run counter to public health best practices?
I've thought about that a gazillion times. Like, how is this guy allowed to practice medicine when he spews so much misinformation going against whatever the FDA says and what we all know as pediatricians to be safe? I know exactly who you're talking about, Mr. Ladapo, Dr. Ladapo. Sorry.
Why I say, like, most physicians will disagree with a lot of what RFK Jr. will say is because that's most physicians. There's still some that kind of hold strong to their own personal beliefs and not the scientific ones. And unfortunately, Dr. Ladapo is one of them. And I can tell you that on the Florida Board of Medicine, I'm sure that there are some physicians that may think that way too, and it's unfortunate that we're not going with the science. As physicians, we're supposed to uphold the oath that we take, and unfortunately, that is not being reinforced.
Medical schools going forward will be influenced by the way that they teach based on the craziness?
Based on the misinformation, I think that they'll try to reinforce, like, hey, this is how to battle it, but I don't think that they'll be influenced by it in a negative way. But in the end, whoever graduates medical school and goes on to training, they're gonna believe what they wanna believe, unfortunately.
Mine is not much of a question, it's more of a comment. I'm a retired teacher who taught critical thinking for 41 years.
I love that.
And when I come across friends and unfortunately family that spew the information that they've read or seen, my answer to them is always, and this I had to write it down so I got it correctly. Why is anyone listening to an anti-science, non-medically trained, former drug addict, lawyer who has a self-proclaimed brain worm? That's what you have to answer.
Thank you for sharing.
Thank you.
That was the best one of the night.
I love the questions. I have one question for you. Has to do with the vaccines, actually. The flu vaccine and the COVID vaccine. He's gotten rid of the panels that determine what is the best way to fight a particular strain of flu each year. How do we know that the flu vaccine that we're taking is going to be effective? That's number one. The second thing is the preservatives. He's gotten rid of the preservatives in the vaccines. How do we know then that the vaccines are going to stay good enough by the time we get to take the vaccine? So those are two questions that I wanted to know.
Those are two really good questions, actually. I was very concerned when the ACIP was replaced with a whole new panel of people. I didn't see as any kind of particular professionals because they had a lot of anti-vax history. But I will say, here's the pleasant surprise, folks. Guess what they did? They still recommended flu vaccines for everybody 6 months and up, like we still always did in the past. And they're still going with what they were going to recommend as the 4 most predicted prevalent strains for the season. And those strains are actually based on the season that's halfway around the world before it hits us, because Australia just finished their winter or finishing their winter, and then it comes to us. So they base it basically on their winter flu season, and they still went along with what had been recommended previously. And so we're still gonna get effective vaccines. The question about preservatives. So interestingly enough, okay, so thimerosal, first off, I will say, is what we call ethyl mercury. It's not the methyl mercury we know as being poisonous or toxic to our bodies. It's actually harmless. It's a harmless preservative used in multi-vial dose of flu vaccine. There's always been in existence the single dose vaccines. They come in a syringe by itself. They don't require preservative. That's been around for a long time, and so that's all we're using now. Basically, we just eliminated the multi-dose vials, and that's pretty much it. No big differences, nothing to, these are all the kind of scare tactics, I would say, because it's nothing like that's all that new. So I hope that's reassuring and that you guys will make sure you get your flu vaccines this winter.
Can I add just something quickly to that? I mean, the Academy of Pediatrics is compiling their own, you would know better than I would, their own scientifically based information, send out to pediatricians so they can pass this information on to their patients. And I know that they're not a particularly political organization, but I think they need to come out and help in terms of information.
Oh, absolutely. They've if you see them on, you're saying the AAP, the social media, they are always out there reiterating the importance of vaccines, the current schedule, and how that we will always follow what has been previously recommended. Nothing new that would be harmful to us.